Yes, this is your card. So you can start once you are ready.
Yes, sir. Uh, let's start, sir.
Yeah.
Good morning, Abraham. I am Christopher, one of the registered nurse working in this clinic, and I'll be taking care of you today. And may I know the reason for your visit today?
Yeah. Actually, I am little bit worried. The doctor asked me to meet you to discuss regarding removal of stitches. Okay, so it was
Yeah.
scheduled. So that's why I came here. But yeah, I
Mm.
want to discuss something important with you. The doctor told me that I had something called squamous cell carcinoma. I think it's another
Yeah.
name just for skin cancer. I'm a little bit worried, nurse. I'm a little bit upset.
There's nothing to worry, Mr. Abraham, because skin cancer or squamous cell carcinoma is caused by exposure of skin to the sunlight or ultraviolet radiation. So it's very common, but surgery is the only effective way for the treatment. And as I can see that you have undergone lesion removal, right?
Yes, of course, nurse.
And cancers are unlikely to spread. And I would like you to recommend some monitoring. Is it okay? You
Yeah,
need to
of
undergo
course.
skin monitoring, such as changes over the spots, any changes over the spots, and regular doctor monitoring and checkups are essential for your recovery.
Okay. Right. I have a better understanding of what squamous cell carcinoma is now, and I want to
Mm.
know if I am likely to need more surgery in the future to remove the other lesions.
Uh, Regarding that, it's not in my hand because doctor is the one who is specialized in this uh, condition. So he'll be explaining you in detail regarding that. Is that okay?
Yeah, that's fine. And I
And
always, yeah, that's fine. Anything else you want to suggest me, Doctor Nurse?
and also I want to know that your habits regarding the skin exposure to the sun. Can you
Yeah,
please elaborate about that?
of course. I always wear a high factor sunscreen 30 or
Okay,
higher. I wear a hat
okay, okay.
when I am
That's
out
good.
in the sun, but I think it's too
Nice.
late because the damage has already been
Mm.
done. I spent too much
Yeah.
time in the sun in my teenage years.
Oh, okay. Uh, and for the prevention, you need to cover up your skin when you are exposing to sunlight. Is that okay?
Yes, of
To
course.
prevent, it is to prevent further skin damage and exposure to sun. And may I know how is your post-operative site, the wound site?
Yeah, that's very fine. I think it's good. There is
Is there
no
any pain,
bruise.
discharge?
Yeah, of course, that's what I'm coming there. And the
Mm.
wound has been fine. There is no pain. There is no discharge also. And I think
That
it's too
yeah.
early to have the stitches out. Don't you think? We can wait for one more week or 10 days. What do you say, nurse?
Actually, the wound healing will be done within 1 week. So it's better to remove and so that we can assess the site and we can move on for the further treatment. Is it okay?
Yeah, of course,
And
nurse.
also after removal, after 7 to 14 days, you can revisit the doctor so that he'll be proceeding with the further treatment. And also, I would like you to keep the wound clean, covered, and well well dry. Is it okay?
Yeah, that's fine, nurse. Thank you very much.
And do I have the consent to remove the stitches now?
Yeah, after listening to you, I'm quite confident. Yeah, so you know better. I thought it will be better
Mm.
if it is one more week, but you say that's fine. Yeah, that's okay. This is my consent. Yeah. Do you want a written consent or oral consent is enough?
Uh, Oral consent is enough,
Yeah,
Mr.
thank you.
Abraham.
You can go ahead. You
Thank
can
you for
remove
the
the stitches,
cooperation.
nurse. Thank you for your kind response and suggestions.
Thank you, Abraham, and have a speed recovery. Thank you.
Yeah, thank you very much. That's it. So, coming to the point, we have here. That's really very good, Christopher. You are doing very well. You are very confident, I think. But you have some fear, stage fear or exam fear, some phobia. I don't know what
Yes.
phobia it is called as examophobia or stage of phobia or whatever phobia it is. There are many different types of
Mm.
phobia depending on the variety of phobia. But this is, yeah, fine. So you have that one. You have that fear, sudden exposure to examination setting. You have that fear. You can definitely overcome that. Coming, squamous cell carcinoma. You have pauses and breaks here and there. So avoid these pauses and breaks as far as possible. How can you avoid these pauses and breaks? Not only feedback, there are some suggestions also which will come after that one. So pauses and breaks. In between, there are some pauses and breaks. You speak something, but uh, then like that. So there are some pauses and breaks here and there, not too frequently, but they are there. But yeah, that is good. And you have to go for s- so like that. There are some and you have to go in between that. There is a pass. But I mean, but and so wherever there is conjunction or there is a marker, there is a pointer or something like that, strategical words, no, then you are like that. You are getting stuck. Instead of that one,
Yes.
without saying that word, you can stop. That is better. Okay. Then
Okay.
hesitation. You don't know what to talk, whether you have to talk or not. When you have to talk, that hesitation is there. So how you will overcome these things? When you talk frequently, the more you speak, the better it will be for you. The more you speak, the better it will be for you. So this I have given you a style. The more you speak, the better it will be for you. The more compliant you are, the sooner the recovery. Like this is one style. I gave you one style. You can use this in your speaking. The sooner we remove the sutures, the faster it will heal.
Recover. Mm.
Yeah, the
Heal.
recovery. The faster the recovery because of the exposure to the sunlight and so you can talk like that. And the sooner the better. This is one style of speaking. The harder you work, the better your results. The harder you work,
Mm.
the better your results. The more compliant you are, the sooner you are recovering, the faster you are like that. The sooner, the better. Sooner, the faster. So like this, two comparative degrees. Okay, you can use this one. So hesitation. This hesitation is there because you do not talk frequently in English. If you talk
Yes.
frequently, then definitely there will be drastic improvement. So what you do is, yeah, you can take one. I'll give you one speaking partner. There is Amar Babu. Okay, Amar Babu is also a nurse, so you can do one speaking session with him in the group. I'll give you his number if he's willing. So you can discuss with him. Okay, you can
Okay,
tell
sir.
Amar Babu, sir told me to practice one speaking session with you. So we can do one speaking session. You give me one card. We both will do the same card like that. Okay. You can tell, you can give your card to him and say, we'll practice this card. Then you can ask her. There is another girl, Grishma. Grishma is also very good. She is very serious. So you can do one speaking session with Grishma. Like that, you can practice more. And you can tell me, sir, I am free today from 5 to 6. Can you conduct two or three speaking sessions for me? I am willing to do. Okay, these are the times I am available. Can you give me your time? So I'll tell 7 to 8 I am free. Sorry. So 7 to 7:15 or 7:30 I'll conduct three speaking sessions for you. I'll tell. So you can take an appointment and you can fix your timing. So like this, you, if I am busy, I am busy or not, that is not your problem. You just say, sir, give me three speaking sessions today. Okay, alternate day or once in 3 days, whenever you are available. Every day also, it's okay, no problem. But if I am free, I'll give you. Otherwise, at least one speaking session I'll take. So, and you have our friends in the group. Okay, I'll give some other students also. Okay, if you want to practice, definitely you can practice. I'll give you. The more you speak, the better it will be for you. At least a daily 1 hour you have to speak. That means you have to do at least six speaking sessions. Okay, one
Okay,
speaking
sir.
session is 5 minutes. One speaking session is 5 minutes. Six speaking sessions, 30 minutes you are speaking. So, so if you want to speak more, 1 hour also you can speak with different people. So I'll arrange something like that. Okay,
Okay,
that
sir.
is how you will overcome this hesitation. I'm giving you an option. Okay, if you come like this, I'll give you an option. Then the problem with you is idea generation. Idea generation. Now, what do you mean by this idea generation? So suddenly some question comes, it's difficult for you to handle immediately. You are taking 3 or 4 seconds to generate that idea. On the spot, it's difficult. But speaking is on the spot. It's not like writing. Writing, you can think. You can think for 1 or 2 seconds, 5 seconds for every sentence. But here in speaking, it's spontaneous. In 5 minutes, you're speaking what you are writing in 1 hour. 40 minutes, you're speaking in 5 minutes. That means you don't have time to think. So on the spot, how are you? Uh, Nurse, I have a problem in the pain. Oh, don't worry. That's not a problem at all. It's quite common. The doctor will give. So this is the way how the things should come. Oh, is that so? That's not a problem. Do not worry. You did not answer him, but still you are talking English. This is what is important. How to react to the patient, not giving answer to him. That is not important. How to react and how to comfort and how to make him at home is very, very important. See, for example, you are the patient and you will ask me like this. You are the patient and you will ask me like this. Nurse, you are the patient. You are telling like this. Nurse, I wear a high factor sunscreen 30 or higher. I wear a hand when I'm out in the sun, but I think it's too late because the damage has already been done. You spend too much time. I spent too much time in the sun in my teenage years. Now, immediately, how I react, see like this. No need to worry, Mr. Lincoln. There is no problem. Past is past. There is no benefit brooding over spilt milk. We cannot get it back to normal, the past. But now, this is the present. Secure your present. We cannot repair the damage which is done in the past. Now, the present is in your hand and future is in your control. So, control your present so that your future will be bright. See what I talked? Nothing. I did not answer you. But this is how. As a normal human being, also, you can talk. You don't need to be a nurse for this. You are to do, you want to give an excellent consultation. No, excellent consultation is linguistic, not nurse related information. Nurse related information only is one sentence, but English related information is total of 5 sentences. After that, you can say, this is all English. There is nothing related to nursing here. Whether you agree or not, but all I spoke is not
Yes, sir.
nursing, it is a general basic English. The doctor has told you that you have skin cancer. Yeah, of course, that's a fact. You have to accept the fact now and you have to live with the reality. Surgery is done. So now the squamous cell carcinoma, the cancer cells are removed. There is a possibility that you are 100% cure, or if chance is there, there may be something missing because we are human beings. Maybe it's not completely done. There may, if such situation is there, in the next turn, you will know when you come for a screening. If necessary, doctor will do a test again and further removal of squamous cells, cancerous cells may be possible. If everything is clean and you're perfectly right, that's excellent. We don't know the condition, right? If it is
Yeah.
perfect and everything is removed, that's fine. But if by chance there are any few cells left, then they may grow and further removal may be needed or required. It's not my it's not in my scope to tell you all these things. The doctor will definitely guide you in the right direction. You are in safe hands. There is nothing to worry. But from now onwards,
Mm.
take care. It is your health. It matters the most for you. Nobody wants to suffer. So I believe that you will take proper care. So avoid going into the sun. And if you are going into the sun, take proper precautionary measures. Don't get overexposed to the sun. Okay.
Mm.
So this is the way how you can skip. I believe that you are matured, you know what to do and what not to do. I need not to tell many things. So now it is in your hands to safeguard your skin. Now, refraining from light exposure is the first priority. In case it is a must and it is an emergency, of course you can go, but precautionary measures are very important. I'm not telling you not to go into the sun, but if necessary, if possible, avoid. If possible, avoid. And if there is no other option, okay, but take necessary precautionary measures because this is your health and protecting, safeguarding your health, safeguarding your skin is your topmost priority. You're already facing difficulty and you do not want to add salt to injury. Okay, it will hurt more and it may lead into serious consequences. So this is the way how you have to speak how you speak in your mother tongue, like that you speak non-stop, speak at a stretch, speak. Go to the mirror, sit in front of the mirror and speak. Nah? Think that Simon sir is sitting in front of you and you speak. Tomorrow, what you do today, select any two cards for tomorrow. Practice. Practice for half an hour first card, practice for half an hour second card. This practice will help you after 1 week. Because after that, you don't need any practice because everything is there in your brain because you have practiced a lot. They will come on the go. You need not wait for them. They'll just come out of your mouth because you have practiced, practiced, practiced. Practice makes a man perfect. Then you said, is that okay? That's not a very good sentence. Is that okay? It's very common sentence which anybody can speak. Instead of is that okay, try to create one another style. Now I'll give you three or four styles, but you create your own style. I hope that suits you, doesn't it? I hope this method suits you, doesn't it? I hope you agree to this suggestion. I believe you do this. Is that clear? Is this suggestion apt? What do you think? What is your opinion? So, different styles are there. You can create your own style. Yeah. See, looking at you, this fellow, Richard, is telling, I also want to come on the video, sir. That's it. You are a motivator for Richard now. So, this is a contagious disease, you know. Good things are contagious disease. When you get good things, you feel you feel proud of it. Others, oh wow, this fellow is getting. See, when you are coming on video, I am coming on video, and I'm giving you a lot of things. When you hesitate, I also hesitate. When you're open, I also become open. When you say, sir, when you're over open, exposed to you yourself, then I will also expose myself. See how many points I'm giving you. But if you are limited, I will also be limited. You have given me a chance to tell you many things now. Otherwise, it will be 5 minutes and close, finished. Right?
Okay.
Yeah. You are not able to overcome the limitations. Why? Because lack of preparation. See, for example, now recently World Cup match, India won the World Cup. You don't know, do you know how much rehearsals, how much practice they have done background? They might have practiced day in and day out. Even in the house, they'll be thinking, they'll be watching videos. This is how I should play. They will be watching Sachin Tendulkar's, they will be watching about Bradman, they will be watching their matches and they'll see how they attacked this sort of situation. This fellow is a fast bowler. So, how I am going to react to this? 1 second, please. Yeah. So, he's a fast bowler. So, this is a very famous fast bowler. How can I attack him? So then he'll be watching how Sachin Tendulkar attacked the fast bowlers or some other cricketer attacked fast bowlers. He'll be watching, oh, this is the trick. Okay, I learned something. He will try the next practice session, net practice. Okay, net practice, he'll
Okay.
practice. Then he'll call a fast bowler in the team and he'll ask him, throw as fast as you can so that I can learn the technique. Faster, 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 more, more. Even if he gets fail, he will not get this. Come on, I do not want to lose this. Do your best. So he is making the bowler also become fierce. That means he's encouraging the bowler to give fast bowling. That means, so he'll say, come on, throw as fast as I want you to. So when the fast bowler throws and he gets out, the fast bowler is the winner. And when he doesn't bowl him out, wicket, then he is the winner. So one time he will win. So like this, there is a challenge in competition. So in this way, you will develop that, fighting spirit. Fighting spirit. So fight, na? Go to the mirror. Go to the mirror. Okay. Take my photo and keep it in front of you in the photo there. Take my photo from the video or somewhere. This video. Take one photo and keep it in front of you in the screenshot. Put it in front and talk to me. Do as much as you can. Let that fear
Okay,
come
sir.
to you. Let that respect come to you. That fighting spirit come to you. Yes, this is a challenge. So not able to overcome limitations because you are limiting your practice time. Limiting your practice time. That limitation should not. Unlimited edition is your secret. The name of the game is unlimited edition. You have fear, do that unlimited edition. Practice as much as you can until you overcome this. The next one, avoid repetition. Avoid repetition. Repeating the same words like okay, is that okay? So, right, okay. These are some common words. Avoid them. Try to create new things. Don't repeat the same word another time. And and but so their pauses are there. Avoid that one. And avoid as far as possible. But avoid as far as possible. You can use whereas, you can use although, you can use in spite of, you can use however, many other things instead of but you can use. Try to explore those things and learn that one in my grammar session. Okay. So too many ands, and 3 or 4 times, 5 times, 6 times, and is a common word. Avoid that as far as possible. Try to avoid it. So practice more. Yeah. So that is Mr. Christopher, squamous cell carcinoma. That's fine. Yeah. Now you can give your feedback. How did you feel? What is your opinion?
This is for the first time we are having this video call conversation, sir. Face-to-face conversation.
Yeah, share your
Uh,
experience. What did you learn? What everything? Everything. How did you feel? Was
uh,
it beneficial to you? Do you recommend this type of sessions to the others?
yes, sir. It's highly recommended because mostly OET sessions are taken in a group and individual sessions are very rare. And also clear-cut review of what I have spoke and grammatical mistakes and everything were given in a detailed manner, so I can improve my weaker points.
Yeah. So
And
that's fine. That is all with Sachin Tendulkar. Sorry, Sachin Christopher. Sachin Tendulkar is my favorite icon for cricket. Okay. So I remembered him because of you. Right. So that's the end of the session.